I hadn't been in charge that many times, but it wasn't that difficult. I mean, you just make out the assignments based on the patients you have with the staff that's available. That shift, we were short-staffed. Just myself, an LPN, and 2 nursing assistants, Ruth and Michaela. Since we were so short-staffed, I gave the hardest patients to myself and to the LPN, Jenny.
This is the first sign of a potential breakdown in the delegation process. Delegation is more than handing out assignments. The delegating nurse must understand the importance of the process and allow enough time to complete all the steps. Skipping steps or scrimping on them is a recipe for disaster.
Delegation is not abdication. Nurses are responsible to provide nursing care designed to meet their clients' needs. Sometimes they delegate, and sometimes they choose to perform the care themselves. Regardless of who delivers the care, the licensed nurse remains accountable for completing the work and for achieving the desired client outcomes. Being accountable means being answerable for the actions or omissions of self or others within the context of delegation. Assistive personnel are accountable for the decision to accept a delegated task and for their performance of that task. They're accountable to themselves, the delegating nurse, and their employer. Nurses have multiple levels of accountability. There's accountability for the delegation decision itself, as well as for the task that was delegated and for the outcomes of that task. In addition, nurses are accountable to themselves, the clients entrusted to their care, the employer, the licensing board, and the nursing profession as a whole for their actions taken or omitted as a nursing professional. In some states, delegation refers only to unlicensed personnel. Licensed individuals practice within a legal scope of practice for which they're accountable. When a nurse delegates to an unlicensed person, there is the expectation of additional scrutiny to verify that there is a match between the client's needs and the ability of the assistant to meet those needs.